My name's Ronnie Beale, and I'm a county commissioner elected in 2006. If you'd have told me in 2006 I'd be involved in mental health in any way, I would have said you need mental health. But that has all changed drastically, and I would too like to thank the league for having this forum. Anytime you can talk about mental health, I've had the opportunity in the past years to talk about mental health literally all over this state. I'll tell you about the mental health task force. Some of these things you've heard from Steve. We'll talk a little about our local jail and how it has been the cutting edge and progression across this state. I also serve as president of the North Carolina County Commissioners Association, which does give a little bit of voice to mental health. That's my state initiative, is mental health. We have a statewide mental health task force now. But our local mental health task force was started mostly by myself and the sheriff. I had been appointed to the Smoky Board in 2006. Been there ever since. Through good times and not so good times and bad times. But about our task force and how important this has been to our county, not because it's me and the sheriff will tell you the same thing, but the people involved. We put people at the table never been to the table before together. We put providers at the table. We put the health department, the DSS, Smoky, after a while. They so we put people at the table, we talked honestly. We put people, like Mary Ann was talking about, the people who really get the services. This was in 06. So, and that mental health task force locally is going strong today. Usually at our meetings we have between 35 and 45 folks. Mostly providers, Smokies at the table, of course the sheriff's department, because it all comes back local. A little bit of the history of how we got to where we're at and why the mental health system is such fragmented. In 2001, the state decided what would be a great idea to reform mental health. You could not draw up a plan and say this is how we're going to screw things up for worse and make a plan to do that. They did it. And they will tell you that today. They will tell you that today that happened. But not everything is bad news. We have made progress. It's slow. What you find out in mental health, and I think Rhonda and the professionals will tell you, everything in mental health is reactive. Nothing's proactive. It's after the fact. We're trying to get it where it's before the fact. And we have made some great strides in that in some ways. What it comes down to is the people you're serving. No other disease. Mental health affects every family in this room. Mental health affects every family in North Carolina. It affects my family. Has since I was a kid. I was from an alcoholic home. Affected my dad. Don't know if that had an effect on me, but I'm sure it did. So, but if it was any other disease in the world, folks, they would be studies going on, they would be things going on. Not with mental health. The only disease, you roll into an emergency room, placed in a room, however you're restrained, for 40, 60, 80 hours, 8 days, no treatment. No other disease in the world would that happen. And you can see I can get fired up because I'm not a perfect. I feel passes. But I've talked for the legislature, and we got some good news on that today, by the way. And so, why it is that? Well, no other disease. So what we do, we cut 700 beds out of the mental health system. We cut $40 billion out of the budget. That'll really help us. We close Dorothea Dix, we'll make it a park. So that really, those things, that's, but does that affect West North Carolina? Yes, it does. It does. But over time, as things have progressed, and I think Rhonda will talk to it, and Mary Ann will speak to it, and Steve, and the sheriff, the ones of us who've really been involved. On the outside looking in, many of you in this room have been involved on the first hand, and that's when you have a child, a mother, daddy, uncle, brother, sister, who needs this care, who needs this care desperately. That's who needs to be involved. So that's what we've been talking about. And locally, some things are improving. I was fortunate enough to be on the first telepsychiatric, where you have the psychiatrist and we can talk about the chores that we've tried to went through to hire psychiatrists and psychologists. Some providers in the room. I've seen Joe Ferra walk in. We can testify to that. But now we have telepsychiatry. So we have a 13-year-old in the ER. She had overdosed on some medications. So that was the first one we had in Macon County. That's been about 4 months. And it worked well. It really did. In other words, there's a camera on to find the patient, and the psychiatrist is on the television, and they talk. You know, we think this should be in every jail in the morning. There's no reason it's not. No reason. The millions of dollars being spent on mental health. So, but now what do you do after they're diagnosed? Well, the sheriff didn't get into the numbers, but he will tell you the man hours real quickly and what it costs Macon County in just a transfer of people from the ER, sitting with them in the ER. It's going to cost you in this previous budget about $280,000 to the sheriff's department out of his budget that he did not come back and ask for more money for, by the way. He used his money out of his budget to pay for this overtime for these folks. But, so where are we today, and has it progressed? How am I doing? Great. So what's going to happen? What do I think is going to happen? I tell you what I think is going to happen. I don't think you'll see many more psychiatric beds put in place. I think that can be a good thing if on the front end they do the right thing. I think if on the front end, if the care is there, and we're going to talk a little bit about that here in a second, if you do the care up front and make sure, and we're going to talk about stigma of mental health. That, folks, is the worst thing that can happen to mental health, is the stigma. And so we're going to talk about that. And so let's talk a minute about what we're seeing locally. It's not uncommon to have 6-year-olds in voluntary committee in Macon County. It's not unusual at all to have teenagers, several teenagers. The youngest I've been with is 6 years old in voluntary commitment. Now, why is that 6-year-old been in voluntary committee? Michael just don't long Michael don't write the story. The grandmother was raising a child. The grandmother we dealt with the child before she'd called. I do go to the ER. They think I work there. I mean, really, these people I don't see. And when you sit down and talk to their families, mental health is like any other tragic disease. It affects every member of that family. This grandmother was raising a child. Long story short, the child needed help. Macon County Sheriff's Department transferred that child to Wilmington. Stayed in Wilmington 13 or 14 days. The child is doing better, doing good, doing a whole lot better. But if this child is 6 years old, now whatever you hear about the state and the money, forget about everything else. If this child is 6 years old, does not get the proper care for the rest of his life, how old is this child going to be? 50, 60, 70 years old. Who knows? Your tax dollars will be taking care of this individual for the rest of his life. So, you know, there's a surplus now, of course, and I was in Raleigh with the governor now. I introduced the governor. I had a chance to introduce the governor. We talked about the money. Of course, the first thing I hit him with, we need to put that in child care and mental health. You know, that's where we need it at. I mean, if you don't take care of the children and the young folks, you're going to have to start somewhere. You're going to have to. And with these young folks, Macon County, we're very, very fortunate, very blessed to have providers who look after our school, and Paula Ledford, who works in the school system. You hear the suicide statistics that Marianne quoted. Those statistics, now you got to take that in perspective of the population, of course, but one is too many. One is too many. So, but if we hadn't had in force Macon Psychology, Burn Spring, Meridian, Appalachian, Jackson Psychology, if these folks hadn't been in place, those statistics would be much worse. I know for a fact they would. So we're talking about young folks. We're talking about 15 and under. When you get to the mental health thing, 16-year-old, that's a different little ballgame. So where do we stand now in Macon County, and how are we doing? We're doing much better. We have a walk-in clinic. We have things that Ronnie talked about that 4 years ago did not exist. What's our biggest challenges now are really simple. Is mental health is that you got to recognize it as a disease until that stigma is overcome, or we work on the stigma. Growing up, I'm born and raised in Macon County, and you looking back, you can see members of the family, whether my daddy, coming out of World War II and self-medicated the rest of his life. I realize that now. That's what he did. I realize that now. So it's been an education for me, but nothing like the Mary Anns of the world who deal with it every day. I can be on the outside looking in, I can beat the drum. But these are the people that matter. And this younger generation coming on. I've got so involved, I showed it to Stevie. When they send you the report from the jail every 2 days from the state, you know you're pretty much involved. This comes last night, North Carolina prison, Mr. Beale. We want to keep up because we talked about prisons and jails. As of night before last, we had a little over 5,000 inmates in state prisons now that were truly diagnosed with severe mental illness. 5,000. Now that does not count the county jails, which, I guess, there's some big central jails that's not counting the state population. That's about 15 to 18% of those incarcerated in North Carolina in state prisons are diagnosed. These are folks who, Stevie talked about, the different kinds of, but there's all levels of mental illness. It's not all substance abuse. It's not all schizophrenia. There's many levels of it that I have come to know. But the jails is your mental health hospital. Good. That's where they're at. Now, out of those, that's about 15 to 18% of the inmates incarcerated in state prisons. Not counting the jail that Officer Stewart runs every day. Very well, may I add, you're very blessed to have a jail system like we have. The actual number of mental health over the past 2 years since we started keeping real records, and since I started asking for them from the Division of Prisons, they said they never had nobody ask for that. The number is actually coming down because the number of prisoners is coming down. But in relation to who's there. Now, who are they? Now, let's talk about men and women. The women will tell you, as they come out, it's over 30%. They admit to a severe mental illness. Now, this is diagnosed mental illness, not just, you think, 30%. So the prisons is acting as that. And you're going to hear a lot. You're going to see a resolution come out of the Macon County Board of County Commissioners that will hopefully pass called Stepping Up. I also serve on the National Association of Counties Health and Human Services Board. And you can guess what I'm talking about dialogue. So this is called Stepping Up, and it's to recognize that jails is our mental health system across it, not only Macon County. You hear Stevie say 100%. So, but it's going to go nationwide. This is every county in every state. And not just that comes from me, but I want the folks here tonight to know that without the mental health task force, without the support of this man right here, and us working together, and a lot of folks in our county, but now I think mental health task force are in at least 30 counties across our state. We were the first. And our state mental health task force, which I appointed a statewide mental health task force to look at where we're at in the state. That report will be given in August of this year. Now the good news. I got a call today from, if you read the paper, you saw where Dave Richards was in town. Dave Richards from DHHS is Behavioral Health Secretary, Undersecretary. So he's pretty much the head man of mental health in North Carolina. And the Secretary, we had a long talk today. They are $30 million in this year's budget. So for the first time in a long time, $30 million bucks. Of course, my reaction was 10 million short, but now that's still got a long way to go. But the $30 million that's in there, the only thing we're going to ask for is county governments and representing the closest to the people is we need to have access to that. Smoky Mountain has went 180, as Ronnie will tell you. Smoky Mountain is an insurance company. More or less, that's what they do. They take the money, distribute it out to the provider. One more thing, real quick. Two things, real quick. I'm gonna go ahead. The providers, if it's not for the providers that we have in our area, and what they do, and what you need to know, and I can list them all: Appalachian, Maryland Springs, Jackson Site, Macon Site, other folks. What you need to know about these folks, Meridian. 30 to 45% of the people they see, they never get a dime or pay for. Did everybody understand that? Just ask them. I saw the numbers. 35 to 45% they don't get. No other business in the world, if you're sitting in this room, can you run a business and do 40% of anything free and have a business. But these folks do it. Why do they do it? Because they cannot turn away these folks, pure and simple. We've got to get providers better pay. We've got to get providers for the, because they're the ones where the rubber meets the road. I mean, they have to work through Medicaid and that bureaucracy, but if you see a provider, be sure and thank them for that. We promise we'll be working on the 30 million stigma. One last thing. When you see this, I've held this up all over the state. This, you know, we're going to be making progress. We're going to have a benefit dinner for Ronnie Beale on Saturday night at any local school. Ronnie is battling mental health illness. We'll have hot dogs, hamburgers, chips, and drinks. And then when you see this in your church bulletin, on your convenience store door, anywhere you see a bulletin, you've never saw a bulletin like this, ever. When you see this bulletin, we've made progress. You know that the stigma is slowly going away. But until you see this, and we can feel comfortable talking about it with each other, we've not made much progress. So we look forward today to this poster. I appreciate you listening. Thank you for being here.